Dr. Philip Solomon is double board certified in facial plastic surgery and otolaryngology and head and neck surgery. He meets with Daniela to discuss her options.
What exactly are you looking to do?
I'm looking to fix my profile to make it straighter.
Okay, great. You're a very pretty girl, and your nose is reasonably appropriate in terms of its proportion, but you could argue that it may be slightly long, and I'm talking a few millimeters in terms of this area through here.
Right,
I don't know, do you agree with that?
Yeah, I do.
Okay, and the next main thing is the bridge of your nose, and the bridge of your nose is also called the dorsum of your nose, is bony up here, which is the nasal bone, and this part here is actually cartilage. You have a very slight, what's called dorsal convexity. It has a little bit of roundness to it. The last part of your nose is the tip of your nose. Your tip, to me, is a little bit long in through here, and it lacks some support and strength to it.
Because it kind of looks droopy, you know?
Dr. Solomon suggests reshaping the bridge and tip. Just how much is up to Daniela.
Any questions at all to this point?
I'm just a little concerned about my recovery time, I guess because I go to school and I have to take some time off with the modeling and acting. So
Right.
What would you...
Well, the downtime from the surgery in terms of just getting back to looking reasonably presentable is probably about 2 weeks. But it takes really many, many months of healing before your nose reaches its final new state.
I want to look good. I don't want to come out looking like scary and death-like. Like, obviously, right when I come out, I'm going to be gross. But after the weeks of recovery and I see like the final, I want to be like, okay, that's good. That's what I was aiming for.
Hi, how are you?
Good, how are you?
Good.
Dr. Solomon sees Daniela before the surgery.
Try to relax. So you seem very nervous, which is normal, but try to be calm. We're going to shorten it just slightly. Take the bump off slightly.
And straighten it?
And straighten it.
Okay.
Okay.
Okay. I trust you. Okay. I love you.
Oh, we'll see you back soon. Everything will be fine.
Right.
Bye.
I think this operation will change my life. I think once the procedure is done, I'll have a whole new level of confidence. I'll feel good on camera. I'll feel good doing what I love to do. I'll be okay?
You'll be fine.
Promise me I'll be okay.
Promise. You'll be fine.
Dr. Solomon begins by marking Daniela's nose for surgery. He then makes incisions to expose the area to be worked within the nose. Next, he cuts the excess cartilage from the bridge. He then works on the bone to slim the width. Lastly, he removes skin from the inside and shortens the septum. This makes the tip appear shorter. Did the surgery go as planned?
I mean, we're working with such a small parameter of change that you really just don't want to overdo a nose like her. So I think I was quite happy with the way things went.
I'm here to see Daniela. Oh, there she is. Oh, hi. You did well.
You did really well.
I spoke to the doctor. She's fine. Everything went well. So now it's just a matter of waiting and taking her home where she belongs.
I love you.
Oh, yes.
I love you.
Yes. All right. I hope that she'll look in the mirror and say, yes, it was worth it all.
Will Daniela be happy with her new nose? Daniela has been recovering for 5.5 weeks. It's time for a checkup with her surgeon.
How are you? Good, nice to see you.
Nice to see
Come on
you.
in, take a seat. Just gonna shine a light in your nose, see how things are healing. Okay. You know, everything looks fine. It's healing nicely. It's still a little bit swollen in your nose. But overall, I think we've accomplished the main things we set out to do. The bridge is being taken down. Feels quite smooth. From the front area here, the nose has been a little bit shortened. And this area here is still healing. It feels a little bit firm to touch, and that's quite calm, maybe a little sensitive.
Okay, and the swelling should go down over time?
Yeah, over time, everyone's different. Some people swelling goes down very quickly. Other people takes longer. To the eye, though, I think things are looking quite good, and I think overall it's pretty much what we had planned on doing for you. Okay.
I'm happy with it.
You're happy? Well, that's the main thing.
I don't think the procedure was a drastic change. It was very simple, and it refined the edgy look, which is what I was aiming for. He did it perfectly, exactly how I wanted it.